Hi everyone, welcome to this webinar, Shaping the New Normal, a New Deal for Care. My name is Helen. I am the Director of Labour Unions. We're the collective voice of the 12 trade unions that are part of the Labour Party, and our job is to bring the collective voices of 4 million working people to the heart of the Labour Party. This is the sixth in a series of discussions that we've had over the past few months about how the trade union movement and the Labour Party can work together to shape the new normal. A discussion about how we can rebuild together after the pandemic. Now, it's really clear that the pandemic has brought lots of very long-standing issues into sharp relief. And in terms of social care, there are a few things that I think we have seen over recent months, but that a lot of the people you will hear from today will have been talking about for a long time. The first issue is that the social care system is in crisis. We've seen the hugely damaging impact of outsourcing, privatisation, local government cuts, and the fragmentation of our services laid bare. We've seen the impact and the consequences of the race to the bottom in terms of paying conditions, and we've seen that particularly with many care workers being put into an impossible situation with little or no access to sick pay. We've gone out and we've clapped for carers every week, but there was no pay rise announced for care workers today. And care workers are, in a sense, the forgotten heroes of this pandemic, too often underpaid, undervalued and underprotected as well, with insufficient and inadequate PPE. And the result of this has been that too many care workers and too many of those that they care for have tragically died. This series is just about identifying it's also about us working together to set out a vision of a better and a fairer society. And it's very clear now, if it wasn't before, that this has to include a new deal for social care, for care workers and for service users. We've got a really exciting lineup of speakers today. We are, as is inevitable, having the usual technical difficulties with the new digital world that we live in. A couple of people haven't managed to get on the call yet, but we are going to hear from Liz Kendall, who is the Shadow Minister for Social Care, who is going to set out sort of Labour's position and Labour's vision for social care. We have got reps from 3 of the trade unions in the sector, Kelly from GMB, Guy Collis from Unison and Lesley Davies from Unite. They're going to set out their members' experiences during the pandemic, but also more broadly, and highlight some of those issues around pay, job security, overwork, stress, the impact of outsourcing, and we'll also share their views about what a Labour government needs to do to rebuild a social care service with fairness and dignity at its heart. We're then going to hear from Dave Allan, who is the chair of Unite's Disabled Members Committee, and he's going to speak about the experience of social care service users as well and what needs to change for them. And finally, we're going to by Sally Renshaw, who's a GMB rep and a care worker, and Rose Malenga, a Unison member and a care worker.
I've lost sound.
And they are going to share their experience of being frontline care workers during the pandemic, but also what the grassroots view about what needs to change and how we can work together as a movement to create that change. So I am going to now pass over to Guy from Unison to give us Unison's take on the situation. So over to you, Guy.
Thanks very much, Helen. As Helen has already said, the pandemic has had really tragic consequences for the sector. But we've also seen how low in the pecking order social care is compared to the other public services, whether that's in terms of getting adequate PPE to the workforce or the inability to get care home residents and staff tested quick enough, if at all, in some cases. But for many years prior to the pandemic, Unison members have been reporting a number of really serious concerns at work, low pay, often illegally low, a lack of training, abusive employment practices. These are still depressingly widespread within the sector. And the crisis has highlighted these as well as a number of other problems for care workers. So particularly workers in high-risk groups have felt pressured into going into work during the crisis. Some employers have refused to pay sick pay to those who are self-isolating with symptoms. Some have even refused sick pay to those who've actually tested positive for coronavirus. And even now, too many care workers are still stuck in this position of having to choose between risking people's lives, including their own, or going without pay. And beyond this, the pandemic has also highlighted some of the kind of wider problems with the existing model that we have. Over the past decade, spending on care has been cut quite drastically. As a result, we've got more than 1.5 million people going without the levels of care they need. Home care is frequently delivered in 15-minute care visits or even less. And more than half of care workers earn less than the real living wage. A third leave their jobs within a year. And as a result, we've got shortages of more than 120,000 workers the last time this was counted. Social care has become a really low status sector as well, with care work too often dismissed wrongly as being unskilled. We have a care market which is hugely fragmented. There's more than 18,000 employers, and many of whom entered the pandemic with their finances on a knife edge. The profit motive predominates in the sector. Many providers are backed by private equity, which has allowed billions to leak out of the sector in rent, in profit and interest payments each year. Regulation in the sector is also weak, and true integration with the NHS remains frustratingly out of reach, despite being something that's been talked about for years now. And this was demonstrated by the ongoing controversy about patients being discharged from hospitals to care homes without being tested. So unfortunately, social care still remains the poor relation of the NHS, with none of the central grip or any of the partnership working that are hallmarks of the health service. So last month at Unison, we put out a new strategy document for the future of social care, which was entitled Care After COVID. And this outlines some of the key principles we think should underpin a move towards a national care service. So it should be based on public funding, and a much larger amount of care should actually be delivered by the public sector. The ultimate goal should be to bring social care up to similar levels of equity and access as the NHS, as well as bringing social care closer to the NHS in areas such as pay and training. And then this would ultimately hold out the prospect in the future of a genuinely integrated national health and care service based ideally on NHS principles. But I think we recognise that such reform, however desirable, isn't going to happen overnight. So in our document, we also recommended a number of more incremental changes that could help smooth the path. So, and first amongst these is the need for substantial extra funding, really importantly, sort of now really, to begin targeting unmet need, to invest in the workforce, and to help councils rebuild their own ability to deliver services. But crucially as well, we need to see social care not just as a cost to society, but also as an important economic sector in its own right. Poverty pay needs to be ended, with all workers paid at least the real living wage. But there's also needs to be standard procedures and contracts in place as well to guard against some of these shoddy employment practices I mentioned earlier. In terms of training, the care certificate that we already have should be strengthened and made mandatory, and professional registration is necessary as well for care work to shake this unwanted label of being unskilled. We need to move away from the current commissioning model, because the system is just too fragmented to provide those in need with the services that staff really want to be able to deliver. And finally, sectoral bargaining in social care is also something which should be considered, particularly for those workers who can't be covered by the existing national arrangements in either the NHS or local government. So I'll leave it there, but sort of suffice to say, this isn't going to be easy to achieve, but the time is clearly right for a much more ambitious vision now of what can be achieved for social care.
Thanks, Guy. I think it's really interesting to hear the sort of perfect storm that was waiting in social care, the combination of the race to the bottom, the job insecurity, the profit motive, impact of outsourcing, private equity, all of that sort of coming together in conjunction with the pandemic has, I think, made everyone realise that these problems need to be solved. And it's really good to hear Unison talking about what comes next, both in terms of the long-term goal of creating our vision of what we want to see, but also that some of the stepping stones that can help to take us there. And some of those are going to have to be arguments we have to have with the current government as well. It can't all be about waiting to win a Labour government, which is something we obviously have to do, but we need to be saying to the Tories, you need to be making these changes now as well. You were the ones on your doorsteps clapping for carers. Now put some of those changes in place that are required, and we'll I guess those are some of the arguments to come over the coming months, aren't they? I think Kelly from GMB is unfortunately still having some connection issues, but I know Joe is trying to get her on the call. So I'm going to pass over to Lesley from Unite to give us Unite's take on the situation.
Okay. As I said, this is the first time I've done anything like this. And for my colleagues and friends outside of Wales, I've got an echo and it's annoying me. How do I get rid of it? Is there any way I can do that?
I don't know. I think we're all muted, so I don't. It's our.
Okay. Watching the TV the other night, we had a programme in Wales called Wales, where they interviewed 4 care workers from a home in Bridgend who were particularly badly affected by COVID-19. I think they had about 18 deaths within a fortnight. And speaking to these care workers, they explained how they felt. And one particular woman said, I've never felt scared going to work before. She said, I've never cried. I've always done my best. But she said, God forbid this happens again. It's just not worth doing my job. That scared me. I know how difficult it is to recruit into social care. Social care tends to be staffed by the older generation. It's very difficult to get youngsters come into the profession. Now, why would they? When the pay is so low and the amount they get paid is so low, they can get that within anyway. This is annoying me now. I'm losing my train of thought. She also said, after looking after these people who had the virus, obviously died, they were holding their hands. No social distancing, no care or thought for their own safety. And after they had done whatever they could for that person, they had to just paint a smile on, go and look after the rest of the residents that didn't have the virus. Then go and talk to their own families, knowing that they could possibly infect all them. Now, surely the government should realise our work. I've worked in care since I'm 17. I have never, ever felt threatened or scared going to work until now. I'll leave it at that for now.
Thank you, Lesley, and that was a really emotive sort of snapshot of working in care has been like for the recent weeks and months, and the people are doing their best to do their job and do the right thing by the people they're caring for, whilst also worrying about themselves, the other people they're caring for, and their families. And it's I think it just demonstrates how unacceptable it is that people have been put into this situation, to be honest with you. And thank you for sharing that with us. I'm now joined by Sally, who is a GMB rep and a care worker who, again, will hopefully tell us a bit about what it's been like working during the recent months, a bit about your experiences, your colleagues' experiences, but also some of the sort of the longer term issues that you face as a worker in the sector as well, like in terms of pay and conditions and things would be really good to hear about. So thank you so much for joining us. Over to you, Sally.
Thank you. I've been an RSCW now for Derbyshire County Council for almost the last 20 years, and I've seen lots of changes, re-provisioning of service. I actually work in LD services, which has evolved over the years to mental health and severely challenging behaviour. Our issues over the pandemic hasn't actually been like everyone else's, because we work with such clients. One size doesn't fit all. And the governing bodies need to realise this. It's been so hard because our clients, it's about the capacity and the goals and the best interest decisions. So our clients haven't actually been subject to the lockdown as such, and it's been so hard. It's the guidance wasn't clear for us. Some clients have wanted to go from say they're in a relationship. I've got a boyfriend, I want to see him. If they've got the capacity to decide that they want to go, then we haven't got any jurisdiction to stop them. So that's been our issue as well. People coming in and out of the building. We've only had a couple of clients, luckily, that did go down with COVID. But the GPs wouldn't come out and just said it was suspected, and just treat them, keep them in the room. That's hard when they've got a learning disability, and some of ours are really severely learning disabled, as well as all the challenges that goes with the mental health as well. For an instance, if we just said to one client, I'm sorry, but you can't go out today, but that might have resulted in somebody being a staff member being assaulted, and that's how hard it's been for my colleagues and my unit. And there's been really nothing highlighted about learning disabilities establishments. And I know one of my colleagues also, she was 70 years old but with no underlying health conditions, and she wasn't able to shield. She was told she had to go into it. So she was so terrified. All the comings and goings. Weeks. She has got sick pay, but that wasn't the issue. She wasn't allowed to shield. It wasn't the right code. So that's gone down on a sickness record. She's not back at work either. And we had the correct PPE. We had everything like that. But we seem to be so forgotten. I don't class myself as an unskilled worker. I class myself as very highly skilled. I'm quite well qualified. I'm one of only 2 positive behavioural support coaches in Derbyshire County Council. And what we get in our day-to-day work, you can go to work at 7 o'clock in the morning, and then you're there till 3:30, but sometimes you might be there till 6. If you go in at 2:30, you might be there till 2:30 the following afternoon. And in that meantime, you might have had the police out about 10 times. There might have even have been a death in the care home. It's quite horrific, and yet we're still being passed over. Okay, right. And while going off, Derbyshire County Council have actually been. They was talking about 7 care homes, and I actually got involved in a Save the Care Homes campaign. But that was quite important because I've been through that as both a worker and my dad was in a home. They need to realise that closing a home must be a last resort, because people go into that home because they've chosen it. It's where they want to possibly end the day is. They get to know everybody, and then they're living in fear of getting ousted. It's been so bad, but I feel proud that Derbyshire County Council have actually rescinded on that decision for now. So, but yes, it's been quite hard. I'm new to all this, by the way.
No, thank you. I think it's I think what you said there is critical, isn't it? It's the fact that anyone can listen to what you've both been saying, and unskilled workers is just, I think. And if one thing comes out of these discussions and out of this terrible situation we've been in for the last few months, it's got to be that we as a society start to reevaluate what work matters and what are those jobs that keep our community running and keep our society running, and care in particular, I think is just got to be part of that reevaluation, I think, hasn't it? And thinking about those crucial roles that, I mean, whether it's social care or early years, those roles that are often done by women, often low paid, with some of the most vulnerable people in society, is absolutely fundamental. I just wanted to ask how you feel when you see the government ministers out clapping on the doorsteps and but it doesn't follow through in the workplace and in the guidance and in all of the practical things that make a difference.
It's actually exasperated us, particularly. What grated on us was when they kept saying that they'd put a ring of care around our day centres were still open on the 23rd of March. Our clients from our units were still going out to a day centre on the 23rd of March. Two weeks after Matt Hancock supposedly put a ring of care around the care home, we were still having admissions well up into April not from anywhere. It was coming from all ends of society because we'd got a spare bed. I mean, as that happened, the last bed went, but they was coming in with they weren't being tested. They weren't even being screened. We had one client that came in and she had come straight from hospital because she'd got quite severe mental health, and a lot of circumstances led to her trying to take her own life. She was actually in the hospital about 3 hours and then released just to us in a taxi. It's quite horrendous. And to see that and to hear what they're saying, it's not true.
Yeah, and I think it's whether there's lots of warm words but very little action, I think, and I think that's one of the things we need to hold them account for as we come out of this situation over the coming months. Thank you so much. We've got a few more speakers, and then we're going to take a few questions and come back to you if that's all right. But thank you so much for joining us. That was a really enlightening contribution. Now I think we've resolved Kelly's technical issues, hopefully, and Lizzie, you can you hear us? Fantastic. And Dave from United is joining us as well. Kelly, can we hear you if you unmute? Not quite yet. In which case, Liz, is it okay if I go to you next? Would that be all right?
Are you calling me in, Helen? I can't hear a thing.
Oh,
if you can hear me, put your thumb up. Can you hear me?
Yes, I can hear you.
You can?
Yes.
So are you calling Dave Allan to speak?
Yes, go for it, Dave. We'll do Dave next, and then we'll come to Liz.
Lip read. I can't hear a word.
So Dave is the chair of the United Disabled Members Committee, and we're really keen to hear the.
You want me to come in now?
Services. Yes, please.
Right. Okay. Thanks very much, Helen. Hi, Liz. It's important that you're here, Helen. Before I go any further, I really do have to express a concern that when we saw this event advertised yesterday, there was 4 representatives of service deliverers there, and not a single service user was represented. It really is vital that all parts of the party and the movement recognise that disabled people have a point to put in, and their voice needs to be listened. This mustn't happen again, Helen, or your organisation will get a reputation of being institutionally disablist. I don't want to score points. I just want to get that over because it mustn't happen again. We as disabled trade unionists, and I'm the chair of the United Union Disabled Members Committee, and I sit on the TUC Disabled Workers Committee, are absolutely committed to the best conditions, the best service for care, and for the workers in that industry to receive. They need the best pay, the best conditions, the best resources. Their health and safety needs to be at the very forefront. But when considering improving the service and a new deal for social care, it must be that service users, disabled people, are considered first, because it is our lives that are affected massively by that. Whether we get care support in our own homes, in residential homes, in supported accommodation, in our employment, out in the community, whether we're on holiday, whether we're at leisure, our support is vital. We need well-motivated, well-trained, well-remunerated care workers to deliver that. Liz, we can never go back to the grotesque situation that I saw when I was a councillor, when this kind of private delivery came in, where service users were being visited at 5 p.m. and put to bed because that suited the deliverer. It didn't suit the client. The whole situation must now come that the client comes first. Could I also say, speaking on behalf of Unite and the TUC, it was unanimously agreed last year that disabled people want a national independent living support service, NILS, independent of the National Health Service, but running alongside it. When we're ill as disabled people, we go to our doctors, we go to our hospitals. But when we need our social care, we need a care service, which is different from a health service. So I would ask Liz for you to take that on board and to make sure that, that it's passed up the chain. We also ask, Liz, I'm sure that you are aware of the difference between the medical model of disability and the social model, but we as disabled activists are massively supporters of the social model. And if there's any colleague who's not understanding what the social model is, it says that we as disabled people are not disabled by our impairment, we're disabled by the way society treats us. So for instance, a colleague with mobility issues isn't disabled by the fact that there's an upstairs. They're disabled by the fact there isn't a lift to take them upstairs, not because they have an impairment. So we would ask that the party 100% adopts the policy of the social model of disability and make sure that people understand it. Could I say, Liz, as well, that I met with one of your colleagues yesterday, the Shadow Minister for the Disabled, Vicky, and in the past, when another one of your colleagues was both first of all, the Minister for the Disabled, then the Shadow Secretary of State for Work and Pensions, and I'm talking about Debbie Abrahams, she set up a group called the Disability Equality Roadshow. And I was involved with it. Some colleagues from DPAC was involved with it, Ellen Clifford, my late colleague, Sean McGovern, and that did some tremendous work. And it resulted in the 2017 Labour Disability Manifesto being written. Could we ask, Liz, that you commit to something similar? A roadshow where we can meet with you on a regular basis, and I'm talking about disabled activists, and put our views, because we really felt at the time we were being listened to, and it really made a difference. Thanks very much, Helen.
Thanks, Dave, and thank you for saying that and for pointing it out. We were wrong not to have included service users, and I appreciate it being pointed out to us so that we could write it, because it's the right thing to do to make sure that this discussion brings on board everybody, and that service users have to be at the heart of that conversation. So I appreciate that, and thank you. And apologies for getting it wrong in the first place. I will now pass over to Liz, who is Labour's Shadow Minister for Social Care, who can set out sort of where Labour is on this issue and the vision going forward, and hopefully be able to respond to some of the conversation we've had already. Over to you, Liz. Thank you for joining us.
Hi, and sorry I joined late. We've just been voting. I think we're done voting for now, so we shouldn't get disturbed by a massive noisy bell. I'm really glad to have been invited to this event. I've worked on social care for the last 20 years, long before I became an MP. And it was interesting hearing Dave there talking about the social model. Back in 2002, I was involved in a project called From Welfare to Wellbeing, the Future of Social Care, which was absolutely about the social model of health and a vision for care that had users and families, not just at the heart, but believing users and families should absolutely be shaping the care services that we get in this country. And that's not just older people, it's adults with disabilities too. And I'll come on and say a bit more about that later. But you asked me to say a bit about what this horrific pandemic has exposed, really. And everybody on this call will have known all of these points for years. But, and I caught a little bit, I came in just at the end of when Sally was speaking. Sally, hopefully I might be able to watch back and hear what you said. But I think that this virus has exposed the fundamental flaws and failures in our system of social care. The failure to treat social care as equally important as the NHS. You'll remember right at the beginning when the NHS was promised whatever it takes in terms of funding to deal with this crisis, and we just haven't had that commitment on social care. And also the failure to understand that the two services are inextricably linked, and we saw that by the consequences of discharging so many elderly people from hospitals into care homes without having the COVID testing. And however the government tries to rewrite history or shift the blame, we all know that there was not a ring of steel around care homes. And I think it's been offensive for the government to seek to try to blame care homes and care workers for the problems. I try and keep calm, but I must admit I did shout at the television when I saw those comments, because I thought they were absolutely offensive to people who've given their heart and soul and sometimes their lives to care for people. And I think nowhere have we seen this exposure of these flaws more than in the treatment of care workers and the staff. You know, the care workers that I have spoken to, what they've experienced just in terms of basic lack of PPE has been frightening. You know, first of all, you know, the PPE was just requisitioned for the NHS. I want our NHS frontline care workers to have all the PPE they need, but it left care workers brutally exposed. I've had care workers tell me about having one mask to last the whole day, going into people's homes. One care worker, you know, they knew the lady that they were caring for, she had COVID-19. She also, you know, has dementia and finds it difficult to swallow and would be spitting, not because nastily, but just spitting onto their mask, and then they had to go to the next place. Care workers who are desperately worried about infecting the people they're looking after, but also taking that back to their homes. We've seen it on the complete failures on testing too. I mean, it wasn't till mid-April that the government even had a plan for social care, even though we'd seen the warning signs in other countries and in this country too. And even then, when they slowly began testing care workers, I mean, in Leicester, the NHS care workers had a testing centre in Leicester, but the care workers were told to go to Beeston, which is, what if they were ill or didn't have a car? How are they supposed to get there? And just, and on the basic terms and conditions and pay of care workers, Public Health England, not Public Health England, the ONS, Office for National Statistics, has just done a review looking at care homes where they had higher outbreaks. I mean, if this wasn't so simple, they found that if you didn't have full sick pay, people were coming in even if they were positive. I mean, you don't have to be Einstein to realise if you don't pay people properly when they're sick, they will come into work, because how else are they going to be feeding their children? And they also found, surprise, surprise, care homes that had a higher reliance on bank or agency nurses or frontline care workers, lo and behold, because people aren't being paid and actually a decent wage for the care work they do. That's why we've got such a high reliance on those agency workers. They had higher infection rates. As I said, you don't have to be Einstein to figure that out. So if there is one thing I hope we get out of this awful virus, it has got to be a fundamentally new deal and new settlement for social care. And that's got to be about transforming the quality of care and support, as well as having a new and long-term funding settlement. We cannot afford to duck this issue any longer. And let me say, mostly who I heard was Dave, absolutely, Dave, we have got to remember that we need a system that works not just for older people, but for working age adults with disabilities, who make up a third of the users and a half of the budget in social care. And for adults with disabilities, it is about independence, having control over your life. It's not about, I absolutely believe we need joined up health and care services, especially for older people when they need it. But as you said, Dave, disabled adults want independence and control, not systems, not a medical model run by the NHS. I also think, and I don't know whether this has been mentioned here, we need to think as well about families who provide huge amounts of care in this country. And many members of trade unions will be not just doing paid work, but also trying to care for their elderly or disabled loved ones. And currently, 1 in 3 unpaid family carers has to give up work or reduce their hours because they cannot get the support they need to look after the people that they love. As a labour movement, and in particular trade unionists, champion the rights of working people not to be forced to choose between looking after the people they love and holding down a job. And the reality of modern family life today is we will be caring for longer as we're living for longer. And so we need a decent settlement for family carers too. Today, when we heard about a pay rise for some frontline care workers, I'm pleased. But what about our care workers? An average salary of £16,000 to £18,000 a year for doing some of the most important work in our country, which is looking after the people, our families, the people we love most. A quarter of all frontline care workers, which rises to half of all home care workers on 0 hours contracts, not getting paid travel time or even decent sick pay. That is not good enough. That must change. And let me guarantee to you, that is an absolute priority from Keir Starmer right the way through this Labour Party. But we can't do it without you. as a movement, we have to make this case, because it's not going to fall into our laps. And I know if we do, and if we build our vision of a future care system with the people who use services and provide services at its heart, we will get it right and we'll make the changes our country desperately needs. Thank you.
Thanks, Liz. And I think the point you've made, that these Tory excuses that they didn't know about these problems just don't wash, because we, the movement, have known about them for years. We all saw it coming, and also the party were there raising them in the House of Commons opposite them for weeks back in March and April as well, when they were making these decisions and getting these decisions wrong. It was really helpful to hear you set out some of these really big challenges and where Labour is on this issue, but also I think that question of Labour really prioritising job security pay for the people who do some of the most important work in our society but are so undervalued, I think is just crucial. And I'm certainly really pleased to hear Labour keeping that right at the top of the agenda. I think we've got Kelly. Can you hear me, Kelly? Excellent. I'm going to pass over to you. If you turn your mic on, hopefully we'll be able to bring you in. This is Kelly from GMB. Over.
Hi, I hope you still can hear me, and apologies for going off and on throughout this meeting. It's been a bit of a nightmare. So yeah, just to give a bit of an update really of what GMB's been doing, and just listening to Liz now, and very much completely understand some of the concerns that have been raised. You know, GMB has been hearing throughout the pandemic since the start in March some of the serious concerns that our members have been raising to us. You know, no PP in some cases, even carers making their own masks, having to go into work because the providers weren't providing them with the sufficient PPE and the correct PPE. I think the biggest focus went on to sick pay and the fact that our members were having to go into work because they had no alternative. They were faced with statutory sick pay, and for many of our members, low-paid female workers, this was not really an option. We campaigned and have continued to campaign for full sick pay for our members in social care, but you know, the government's £600 million funding that they've given to providers just hasn't been good enough. We are aware that many of the social care providers haven't even applied for the funding. One, because it's too complicated. It actually the hurdles they have to jump to get this funding, they're actually choosing not to accept the funding. And therefore, if they're not accepting that funding, it means our members are not actually receiving full sick pay when the funding's there. And that's, you know, that's really disappointing, because one of the biggest campaigns that we've been trying to run is to get full sick pay for our membership, because this is the biggest part of infection control. It proves that, you know, we're going into flu season starting September. Infection control for our care members is priority. It is what keeps the residents and the vulnerable people safe and well. To have true infection control, you must have full sick pay. And that's one of the biggest campaigns that GMB has been running and will be running going forward. It's something that this government has ignored, quite frankly, and I think has paid lip service to. The remarks made today about, you know, not being aware of the issues within social care, I think, quite frankly, is an embarrassment to the government. Why didn't they know? I think that's the question they need to ask. If this government didn't know what the problems were with social care, they really need to take a good sharp look at themselves and understand why they didn't know. It wasn't as if we weren't having clear warning from Europe about what was coming forward and what was coming towards us. You know, our social care members from GMB have been absolutely shown professionalism throughout this pandemic. They are still dealing with the issues that are facing them on a day-to-day basis. They are extremely professional, they are qualified, they are skilled, they are just not recognised for it. And, you know, even now, this government does not recognise it. You know, Labour, the trade unions really do have to push forward, because with COVID, what it has highlighted and what it is shown to the public is how important social care really is and why it is needed, and the support that it gives to the NHS. Because quite frankly, it is proven that without the social care, NHS would have really struggled through this pandemic and wouldn't have coped and wouldn't have managed. You know, social care has been absolutely essential. We really now have to make sure that going forward, social care is not forgotten. And as a movement, we have to do everything we can in our power to identify and recognise and professionalise to what they really are, recognition and what they absolutely deserve, because we're going to need social care now and in the future, and it really does need to get better. We need to improve it. We need to make this a national care service that we can be proud of. So I think that's it from me, Helen. Thank you very much.
Thank you so much, Kelly, and thank you for persisting through the technical challenges we had. We're now going to move into a few rounds of questions. We haven't got a huge amount of time, so I'm going to my colleague Jo has helpfully amalgamated a number of the many questions that we've had in, and we're just going to work our way backwards through the panel, I think. And then Liz, do you mind wrapping up at the end? Would that be all right? Fab. Right, I'll run through the questions that we've had. You don't all have to answer all of them. Don't feel you need to say things that people have already said, and so on. And if there's anything that you wish you'd said before, this is your chance to say it. First question is about trade union organising. Question from Sandy. Tell us a bit about what it is like organising and recruiting in the sector. Are workers nervous about putting their heads above the parapet? Obviously, with sort of job security as it is, and in privatised industries, it can be particularly hard. So what is it like organising and getting people into union membership? We've had a question about the National Independent Living Service that Dave mentioned. People are keen to hear more about that and what it would look like, and sort of structurally, but also what it would practically mean for service delivery and so on. So hopefully Dave can tell us a bit more about that, but if others have views as well. Question from Gail about how we, I guess, elevate the status of the profession. Like, what do we practically need to do to sort of put into practice what we've all been talking about, which is to say that care, and be it social care or caring for children, but caring professions are so fundamental. Like, what training needs to be in place? How do we, what are the practical things we need to do? Not just saying clap for carers, but how can we make the changes to change the nature of the profession and put it on a different footing, I guess, to make those practical changes. And then a question about, I guess, integrating it all and the structural stuff, because care is obviously very complex. I think Guy said there are 18,000 providers. You've got homes, independent living support, in-home care, families caring for family members, as Liz mentioned. Like, what does an integrated system look like? How would a Labour government pull all this together to make one service? And what are the practical things that we need to do? So questions around organising for trade unions, independent living service, changing and elevating the status of the profession, and the question about the practical complexities of integrating the situation. And it's bath time in my house and there's chaos going on outside, so I am imminently muting before it all bursts onto the screen. So I'll go in reverse order in some way. So Kelly, do you mind sort of chipping in on whichever one of those questions you'd like to?
Yeah, okay. I think, I'll obviously go for the organising, and I think it actually varies depending on where we go. I know in the experience I have with organising in residential care, that tends to be a little bit easier than domiciliary care, simply because we can actually access the carers and we're able to meet with them and the workforce. Domiciliary care is notoriously difficult because quite often a lot of these companies are basically, somebody with a laptop in the kitchen. There may not even be an office that the staff actually go to. They are sent their calls on a mobile phone app. So actually accessing these members to recruit members and organise members is, it is challenging in domiciliary care. What you also find well is, I think, felt so over the past 10, 15 years. They don't actually, in a lot of cases, they don't value themselves enough to actually challenge and to join union. In some cases, they don't see that they're worth it, and they just go, well, that's for the professionals. It is about explaining to our member, you know, into the workforce is that actually step, and in some the way I try and organize is by saying, look, you will match from the people that you're improved. So it is challenging, and I think as unions we've got a lot to do. There's enough unions there and enough non-union members within social care, but it is very much a challenge on, you know, in organising in the sector. I just want to say quickly about professionalisation. We have to have some kind of structure that recognises the workforce, their training, the qualifications, and in the devolved nations we have registration. In Wales, in Scotland, there's a registration process that's there, and within the registration process there is training, skills and knowledge that is then recognised. So that may be something that, you know, we need to look at within England to say, well, you know, what is a care worker, what level are they skilled at, what are the qualifications that they need to do the role, and perhaps something that we need to look at within England. But it's, you know, it's been going on for a number of years now in the devolved nations.
Fab, thank you, Kelly. Joe is I'm calling on Joe, who's doing the tech. Do we know if Dave is still on the call? Because I was hoping Dave could come in on the National Independent Living Service.
I have just invited Dave to come back on. Hopefully he'll be imminently.
Fab. And with should we go to Sally?
Yeah, Sally.
Hi, Sally. You know, some of those questions, or just anything else that you wanted to say and sort of as part of the discussion. Oh, I think your mic's switched off.
Is that better? Can you hear me now? Hello?
Oh, yeah, I can hear you now. I think it went on, but now it's on again.
Yeah, I mean, it's like the one, I don't, the nationalisation of the care service, that's anything like that, or the issue of joining a trade union in care homes. A lot of people don't feel because some, even in our, some are part of Unison, some are part of GMB. We're all encouraged, you know, to sort themselves out. But I do think it's paramount, because there's so much these days that you need some backup. You can't do it yourself. And my definition of social care is, it's just caring for those who you love or you work with, and just doing the best of your ability to make sure that they live the fulfilled lives that they can achieve. I work with learning disabilities and disabled, mental health and challenging behaviour. My role is to bring out the best in those people, whatever they do, whatever they want to do, we will try to achieve it for them, whether they live with support alone. I can remember years ago when I first started, we was asked to take them to some clients to Blackpool Pleasure Beach. Some of those clients had never been on a ride in their lives, and somebody said to me, how are you going to risk assess? We went on the Pepsi Max. How are you going to risk assess that? And I says, my risk assessment is on the go. They want to do it. I've evaluated the risk. I'm going on with them. Let them do it. They still talk about that 17 years later. And that is how I define social care. It's what I'm in that role to do.
Thanks. Thank you, Sally, and thank you so much for joining us. Dave,
Yeah.
can you hear me? A bit. Yes. But we had a question, Dave, about the National Independent Living Service, which you mentioned, about the work that's gone into it and what this vision of social care looks like. And I just wondered if you could expand a little bit more on that. I'd be really interested to hear about it. I think your mic's off as well, Dave. Sorry.
I'm back on now. Right, lovely. First of all, can I say how gladdened in my heart I am that Liz not only understands what the social model is, but agrees with it. That's a great step forward for disabled people working with you, Liz, if I can say that. And it goes hand in hand with the National Independent Living Service, because there is a big debate going on in the disabled movement at the moment as to how we take that forward. But we would like to talk to you, Liz, about that. And for Sally, it basically is that disabled people don't anymore want care services delivered by local authorities. They want a national standard. And the only way you can do that is to have a national service. We can't have these Tory authorities who just denude the care services of money so that the basic service can't be delivered. It needs to be national standards delivered by a national body. But we in the disabled movement, Liz, we'll talk to you, we'll talk to your staff, and we will take this one forward. Thanks very much.
Or can you hear me now?
Yeah.
Yes, excellent. Joe, do you know if Guy is still on the call? Or have we lost Guy?
I will call up Guy now.
Fab. And I think Lesley as well, and then we'll come to Liz to wrap up. So Joe's the technical wizard behind the scenes, whose voice you can hear but face you can't see.
Okay, if Guy, if you're on the call still, please accept, and we'll try and get you back. I'll try and call Lesley as well. I'll try and call Lesley up as well.
If not, we can just wrap up. It's nearly 7 anyway. So.
Yeah. Okay, so looks like Lesley should be up soon.
Hi, Lesley. We just wondered if you wanted to come in on any of those questions, like particularly around organising with your colleagues as well, and union membership, and sort of how you go about recruiting and so on. It'd be really, really good to hear how we can try and build the movement in care.
Yeah. As Kelly said, domiciliary care is almost impossible to recruit in because you just cannot get to see them. The last few months, we've even tried to get in residential because they've been locked down. Again, a lot of people don't want to join unions because they can't afford it. Simple as, they're not getting paid enough, and yeah, £14 a month or whatever it is, that can buy bread for a fortnight. So what are they going to choose? Eating or joining a union? I know what I chose. At the end of the day, what no one has mentioned in all this is how both service users and staff have suffered with their mental health. That's not been mentioned at all during this. And what I will say is, I've met with members who have said, if this happens again, for the amount of money I get paid, I'm not willing to do it again. I'm walking away. I'm going to look after myself and I'm going to look after my family. If that happens, who is going to do the job? The NHS will be more than overwhelmed because homes will have to close. There will be no one to do the job. That's all, thanks.
No, thank you, Lesley. And I think Guy mentioned at the beginning that's 120,000 job vacancies already. And I think you're right. One of the things that maybe has been overlooked is the fact that there's going to be a sort of post-traumatic stress experience for loads of people who've been working on the front line during this whole experience, and service users as well. It's obviously gonna be a big challenge that needs to be resolved, and I would say I hope the government are thinking ahead to that, but we will anyway. That's it's something that we need to be talking about, isn't it? I think, and yes, protecting people, but also caring for the workers as well. So thank you so much for your contribution. Guy, we're going to wrap up shortly, but I just wondered if there's anything else you wanted to say, but particularly about sort of like some of the structural stuff about how, if we're pulling together a national service, how do we practically do that? How would Unison to practically pull the sector together into an integrated service somehow, and some of those sort of really big challenges?
Yeah, thanks, Helen. Yeah, sorry about the technical issue there. I was still on the call. So I think we're clearly a long way away from that place at the moment. The pandemic has shown just how sort of frustrating these attempts to integrate the two services has been. But one of the things we've kind of suggested is that if you can begin to try and bring up things like social care terms and conditions, pay levels, training, if you can begin to bring them towards what already exists in the NHS, then at least you have the potential of trying to integrate the workforces, allowing there to be some way in which care workers could move into the NHS if they wanted to, or even vice versa, which I think it comes back to that crucial question before about the kind of status of the sector. And ultimately what we want to try and see is that social care is seen as a high status sector rather than a low status one as it is at the moment. So anything we can do to try and debunk those myths about care work being unskilled, whether that's through the kind of the immigration plans that the government has, which clearly don't prize social care jobs highly enough, then any of those sort of things are a stepping stone on the way to doing that.
Fab, thank you, Guy, and thanks for joining us today. And finally, I'm going to hand over to Liz to sort of wrap up our discussion. So over to you, Liz.
Thanks. And it very much follows on from the last comments here, and the question about how do you elevate the status of the profession. For me, there's two things that are really important in any debates about what's national. One is pay, terms and conditions, training, progression of care workers. It is unacceptable that we are still in a situation where some people are getting no sick pay, where we don't have that properly structured system of training and progression that we see in the NHS. And ultimately, to see the two services linked, that's got to be our goal. And I think what Kelly said as well around registration being a key element of that, it is really important. I was quite interested though on the ask a question thing here. I think Gordon Sim said something about name and shame people who don't provide sick pay. I think that's a very interesting idea, Gordon. It's just unacceptable that you don't, not to mention dangerous for care users and other care staff in light of COVID. The second thing I wanted just to finish on was about how you integrate services in the NHS and social care, remembering the caveats and the points that Dave has raised about, disabled people aren't sick. They don't need, it's not about being sick and in the NHS. You may get sick, but that's not the permanent, that's not the issue. I mean, in the experience that I've seen of effectively integrated services, there are joint budgets and joint teams that have the users of services at their heart, because, you know, if you really develop policies with the people who use services, you know, they don't think, oh, I have a health need over here and a social care over there, or, you know, social security and welfare over there. It's one person who sees their needs as joined up. And the best services that I've seen, if the development is led by the people who use those services, they don't have it all separate. They join it up because they are one person. And again, I think in one of the questions, Judith Wardle said, whatever happened to the document in 2014? One person, one system, one team. Surely the solutions are pretty much like that. So I very much agree with that. And I just want to finish on the point about defining social care, which is, we believe that social care is a social model. It's not a medical model, but it's about enabling people to live the life they choose, you know, in the place they call home, with the people they love, as part of the community. It's not just about help to get people up, washed, dressed and fed, vital though that is. It's about feeling that you have connections with people, you're not left lonely and isolated on your own, that you have help with shopping or to go out, to meet people. And I think that if we think about it, enabling people to live the life they choose, whether they're a working age adult with a disability or an older person, that makes you think very differently of the sorts of services and support that you need to fund. We need, I believe, national standards for staff, but also national eligibility criteria for the kinds of support you get. And the earlier on you can get that support, the better for you, and actually the more efficient use it is of taxpayers' money. So, and I think that is a different way of thinking, I mean, certainly from this government. And let me just finish on saying, you know, I hope that we can continue these conversations, because it is only by working with people who use services and who provide them that we will get the right answers. So thank you this evening.
Thanks, Liz, and thank you so much for joining us. And I think it's really positive to finish with that vision of a holistic service that is really grounded in what can improve people's lives and help people live the lives they want to lead. And I think having heard some, I think, quite harrowing stories about what the experience over the last few months, I think turning to think about how we rebuild and how we as a movement work together to shape a vision of a better society has got to be sort of where we turn our eyes now to win those elections, to put us in a position where we can do this, because the government are not going to do it for us. Thank you so much to everybody for joining us, to all the people who've come along to watch, participate, ask questions. Thank you so much to all of our speakers, Liz, Kelly, Guy, Lesley, Dave and Sally. I hope you've enjoyed the discussion. It sounds like there's loads of work to do on this, and that loads of conversations are already happening between the party and Liz's team and key people in service user groups and in the unions representing the workforce, which I think is really positive. This is the 6th in this series that we've done. We're going to pause the series now over the holiday period, do a bit of a review and a refresh, and get plans in place for how we can continue this debate about how we can work together to rebuild after the pandemic in the autumn. We're going to be rolling out some new training and education programmes for union members who want to get more involved in the party, but also for key workers who want to put their skills and their experience into practice to help rebuild by standing to be Labour candidates in local government as well, because we need you, and we need you to be part of the party and part of us in office in local government across the country, helping to deliver these changes as well. I want to say thanks to everyone who has joined us throughout the series to watch, to all of the speakers. I also want to say a huge thank you to my colleague Jo, who has done loads of work to pull the whole project together. Thanks to everyone. Enjoy the summer. Stay safe, everyone, and we'll be back in touch in September to keep this discussion going and keep building for the future. So thanks, everyone, and see you all soon.